Well, good afternoon, everyone, and welcome to Public Health's virtual education series, Wažookį, Family Conversations. I'm Renelle, public health nurse, joined by Jamie, community health representative supervisor, who's going to help me moderate today's session. The goal of this series is to gather, learn, and share about Ho-Chunk culture, resources, services, and the connection to health. In public health, we focus on prevention, promotion, and the protection of health and well-being of our communities. Health and well-being are rooted in many aspects of our lives, from our physical body, our mental health, our spirit, the environment we live in, and much more. During these sessions, we will explore topics that can impact our health and well-being. Together, we will learn about tools and resources to improve our health and the health of our communities. Although it might not look like it outside after all the snow we got yesterday, today is the first day of spring. Each year on the first day of spring, we observe National Native HIV/AIDS Awareness Day, a day to promote testing, prevention, and treatment of HIV, and to break the stigma around HIV and AIDS. Today, we also honor those who are currently living with HIV and those we have lost due to the complication of AIDS. We are joined today by Jennie Steele, prevention specialist from Vivint Health, an organization that strives to provide whole person care to those living with HIV and to stop the spread of HIV through education, prevention, testing, support, and treatment. We'll have about 40 minutes for Jennie's presentation, and we'll try to have time for a Q&A at the end. Please use the chat function to enter any comments or questions for our presenter. Jamie and I will monitor the chat throughout the presentation and read the questions for Jennie at the end. You can also raise your hand and come off of mute during the Q&A to ask questions out loud. Any questions that we don't have time for, we can send to Jennie and then email responses back to the group. This session is being recorded and will be posted on the Department of Health website and our Facebook page. Everyone, please welcome Jennie Steele.
Thank you, Renelle. It's a pleasure to be here. I always appreciate when you reach out to me and have me come present or attend a event or do testing or anything with the community. I really enjoy coming out and meeting people and serving the community. It's a very underserved community and a community that I really enjoy working with. So thank you for that. As Renelle said, today is National Native HIV and AIDS Awareness Day. And so I'm going to go through a little bit of information with you. Some of you might already know some of this information, but for those of you that don't know, you're going to learn some things today, hopefully. And for those of you that do, maybe you might still learn some things. I know I still learn things every day. But hopefully you'll gain a little bit of knowledge and be able to know some more things about maybe where some community resources are. We'll talk about HIV and AIDS, just the basics, go over some common myths about HIV and AIDS. We'll talk about HIV and AIDS in Indian country specific, and then how to prevent the transmission, treatment options, and community resources. So HIV and AIDS. What is HIV? HIV, otherwise known as the human immunodeficiency virus, is a virus that attacks the immune system. There's no cure for it. However, there is treatment available. AIDS is the acquired immunodeficiency syndrome, which is a set of symptoms that are present in very late stage of HIV infection. So many people think that HIV and AIDS are the same thing, but they are in fact not. And most people that are infected in today's society usually do not progress to AIDS if they are detected and know their status and are able to get put on medication and treated. They actually can live very healthy lives and can even be healthier than people that are not living with HIV because they get pretty excellent care. So it's no longer a death sentence, which is wonderful. A little bit about how HIV affects the body. So antigens are toxins or foreign substances which induces an immune response in the body, and HIV gets inside the CD4 cells and replicates itself. So it just works over time, making more of itself to take over. And just a little complicated graphic there. So with the antibodies then, those are proteins that are produced by the body's immune system that identify the harmful substances and neutralize them to prevent the host from getting sick. And so the cell then dies, it erupts, and the new viruses go off to infect the other CD4 cells. And you can see the little process going on there in that diagram. So then, I don't know if any of you have heard of the U equals U, but that U equals U stands for undetectable equals untransmittable. And what that means is when people are on HIV medications and they're taking them as prescribed, the medication can actually make their viral load so low that if I were to test them with a lab test, they would be undetectable. So they wouldn't actually come up as having HIV for me. And then they would not then be able to transmit the HIV onto their partner. So a viral load is when the viral load is of the amount of the HIV in the blood is so low that it's not able to be found on a lab result. And this graph or this diagram over here shows that it's to become undetectable from when you start treatment, it takes anywhere from 1 to 6 months to become undetectable. So it can vary for people. It kind of depends on where a person stands with their viral load and how long they've had the HIV infection. And then everybody's body is a little different. And then it takes 6 months after becoming undetectable to stay undetectable. And then and you have to be consistently taking your medication. So they figure once you've become undetectable, if you're sticking to the routine and doing everything right, and you will continue to get tested and everything just to, following up with your routine checkups and staying in care, they call it. Then within 6 months, at that 6-month marker, you should continue to be undetectable. And then therefore you cannot pass HIV through sex as long as you stay undetectable, which means you're taking your medication daily, you're seeing your healthcare provider regularly to monitor your test results, which is great. I mean, people can have healthy relationships with other people that are not living with HIV. They can have babies that they don't pass the HIV along to. If they're taking their medication, they're not detectable. They can even breastfeed their babies. It's a big game changer for people. Signs of HIV infection include fatigue, swollen lymph nodes, sore throat, diarrhea, chills, rash, fever, muscle and joint pain, ulcers in the mouth and genitals, and night sweats. So very similar to the flu or other things. So people can commonly mistake HIV infection for things like that and not go get tested. HIV is transmitted through blood, and that can be through sharing needles, through unprotected sex. It would have to be a lot of blood involved, but it happens. Rarely, but it happens. And not as much anymore, very rarely in fact, but from infected blood products like blood transfusions and things like that. Semen or pre-ejaculate, which would be unprotected anal and vaginal sex, and vaginal fluid, which can even happen during transmission during childbirth. and breast milk, although that would only occur if a mother is not taking her antiretroviral medications. So a lot of providers are receiving a lot of education on understanding that if a mother is living with HIV, that as long as she is undetectable, that it is safe for her to go ahead and breastfeed her child if she wants to. Common myths about HIV and AIDS. So HIV is not spread through handshakes or hugs. It's safe to touch people. You're not going to get it from kissing or sharing drinks or food. You would have to swallow gallons and gallons and gallons of someone's saliva, which is very disgusting. Please don't do that, to catch HIV from saliva. So I just actually tested someone the other day that was concerned because they found out that someone they know has HIV and they had been sharing a soda with them. And even though I educated them about, how it's transmitted and everything, for their peace of mind, they still wanted to be tested. So I tested them, and of course it was negative, but these are very, very common misconceptions for people. Some people really do believe that only certain groups of people can get HIV. That goes way back to the 80s where people thought it was a gay disease, things like that. That is false. Anyone can be infected by HIV, even if it's the first time being exposed to the virus. People think if they have an undetectable viral load that they can't spread HIV. This is true. So a person living with HIV who is on treatment and maintains an undetectable viral load has zero risks of transmitting HIV to their sexual partners. We just talked about that. Many people think mosquitoes spread HIV like they do malaria. Very, very rare. I don't know if they've even been able to actually prove that it's happened, but most people are infected with HIV through sex or sharing needles or injecting or syringes for injecting drugs. I personally have never heard of anyone getting HIV from mosquitoes. And HIV can be cured. We are very, very close, but it is not there yet. There is currently no cure, but it can be treated. When treated appropriately, you can prevent HIV from developing into AIDS, which is where you get your major complications that lead to death. Most people, when they're dying mostly from other health issues like pneumonia or heart issues and things like that because their disease has progressed. So there's now, because of the medication, people are living a lot longer, and that's actually something that we are seeing, is that the people that are living with HIV are aging, and so that is a theme that we're seeing now, is that we have this aging population of people living with HIV because they are healthier, they are getting better care, and so that is something to kind of look at as we move forward, is to see like their comorbidities and see if they, just because obviously we do run into things as we age with health issues and things like that. So, but in general, as far as like AIDS complications go, if people are taking their medication, they don't really have those issues like people were having in the 80s and 90s. Now, to get a little more specific about HIV and AIDS in Indian country, we have HIV and AIDS, which are disproportionately affect American Indians and Alaska Natives communities within the Indian Health Service, playing a critical role in addressing the epidemic through prevention, treatment, and support services. American Indian and Alaska Native males were 1.8 times more likely to have a diagnosis of HIV infection than non-Hispanic white males in 2022. So that's pretty significant. Like I said, when we first started talking, very underserved community. And I think, this speaks to that, just like the next fact here, that Native females were 1.6 times more likely to have AIDS in 2022 compared to non-Hispanic white females. And in 2022, American Indian and Alaska Native males were 20% less likely than non-Hispanic white males to die of HIV infection. And in 2022, Native females were nearly 3 times more likely than non-Hispanic white females to die of HIV infection. Those are sad numbers to read, and we need to do better. And I know that we're trying, and it's hard to think about things that are going on in the government right now with the thought of prevention going away. And that's why the work that we do is so important. And I urge you, if you have the ability to reach out to people, to call your representatives and speak to them and ask them to fight for prevention, because these numbers are going to increase if we don't have prevention services available for folks. And we have just had funding that has increased or been released prior to this to move forward with these efforts to try to narrow these deficiencies a little bit and try to reach these areas. I know that there's been efforts to put vending machines in places, and I personally do mobile deliveries, and there's mobile labs that go around now and things like that. So, and I'll talk about that more a little later, but just trying to get to some of the places, because it's hard because of the rural setting people live in, or because of, different, the culture not wanting to talk about things, or, being a taboo topic or whatever it might be. And so it's just, when you have it in words in front of you, it just is kind of like a little startling to see the difference there. And not a lot of people want to talk about it. The CDC estimated that 3,000 American Indians and/or Alaska Natives are living with HIV. The Indian Health Service reported that only 21% of urban Native patients had been tested for HIV at urban Indian health programs, and at some point in their lives. American Indians and Alaska Natives represent about 1.3% of the US population and less than 1% of the HIV diagnosis in 2018 in the US. I'm not going to read all of this, but basically what this is saying is that there was a study done, and it just pointed out that out of all the different subgroups that we keep circling back, that the American Indians and Alaska Natives have the lowest representation in being served and knowing their status and getting treated. And it's causing, health disparities and deaths and further spread of infection and, trauma. And so it's just basically showing that, again, we need to do better. There are over 560 federally recognized American Indian and Alaska Native tribes in over 170 languages, creating culturally appropriate prevention programs for each group. It can be challenging because each tribe has its own culture, beliefs, and practices. Compared with other racial and ethnic groups, Native Hawaiians and Pacific Islanders and American Indians and Alaska Natives have the 3rd and 4th highest rate of new HIV infections, respectively. Of those diagnosed with AIDS, natives and the shortest overall the shortest overall survival time, with 87% living longer than 3 years. That's not long. And we have the ability to let people live long lives. So there's a disconnect there, and we need to fix that. We need to find where people are and get to them and get them the services and get them the meds and prevent some of this from happening, because that's a big percentage in a short amount of time. So this is happening because we have underreporting, we have misclassification of individuals on medical records and in surveillance data that can lead to underreporting of cases. We have stigma, and I'll say that again, we have stigma related to HIV remains a significant barrier to accessing prevention and treatment services. The disproportionate burden of communities experiencing a higher rate of HIV and AIDS compared to other racial and ethnic groups in the US, and limited access, like I was talking about, many individuals living in rural areas with limited access to healthcare services, including HIV testing and treatment. So to prevent getting HIV, some of these things are pretty standard, like wearing condoms when you have any kind of sexual contact, whether it be anal, vaginal, or oral sex. There's a lot of people that don't want to use condoms. Well, then they should be getting tested regularly. Everybody should get tested at least once in their lifetime if they're not, carrying out risky behavior. I get tested at my annual exam every year. I was married before my husband passed. I was married for like 10 years, and now I'm in a committed relationship, but I still get tested just because it's common practice for me, and I like to know my status. I'm preaching it all the time to other people. I think it's good to practice what I preach. And I do work with other people's blood, so I think that's responsible of me to do as well. And so for those people that I help that maybe work in sex work, or men that sleep with other men, or couples that maybe, blur the lines a little bit and mix things up, or people who inject drugs, whatever the risk might be. I recommend anywhere from every 3 to 6 months that they get tested, just to make sure that, they're knowing their status, or at least we recommend that, if you're every new sex partner, but that could be a lot for some people. So it just kind of depends. But being aware of your sexual history of your sexual partner is important. And if you're not going to use a condom, consider taking PrEP. PrEP is a medication, and I'll go into that in a second here, is a medication that can help you prevent getting HIV. PrEP is a medication that you can take if you think you've been exposed to HIV. And then, of course, if you're someone who injects drugs, you should always be using a new needle every time. So what is PEP? PEP is post-exposure prophylaxis. It is a combination of 3 medications to prevent contracting HIV in emergency situations. The window period is 48 to 72 hours after exposure to HIV. So people that would take PrEP could be someone that's been exposed to HIV during sex. So say you got together with someone and found out that they have HIV, or you heard through the grapevine that they have HIV, so you're concerned. As long as it's within that 48 to 72 hours, that would be appropriate. or if you were sexually assaulted and you don't know, or you did find out and you know, and it's been within that time frame. Drug users who have recently shared needles, healthcare workers who might have been exposed to HIV on the job. It should be used by people who are HIV negative. When a person starts on PEP, an HIV test is done to determine the HIV status. If a rapid HIV test is not available and the test results may not be ready for, they're not immediately ready, they'll start you, the emergency room will start you on PEP right away. So you may not know your HIV status. So that is, a risk that the emergency room takes. PEP doesn't always make you feel that great, but it's basically where it's a medication that's working through your body to attack that virus if it is in there. If taken consistently and correctly every day for 4 weeks, the risk of HIV infection, if not taken, the risk of HIV infection will increase. But if you take it correctly, then you should not contract HIV. You'd need to be monitored for side effects. Other blood tests might need to be taken, and of course, you wouldn't want to be having any unprotected sex while you're taking the medication. This is not as common as PrEP. PrEP is pre-exposure prophylaxis and is the medication used to prevent contracting HIV. So there are currently 2 forms of daily oral medications for PrEP and 1 long-acting injectable form of PrEP. There's technically another long-acting injectable, but I don't know if they've actually started using it yet or not. I'm going to be going to a conference in Atlanta in April 10th through the 12th, the biomedical conference. So I'll be learning more about it, but they did come out with one that you take every 6 months, and they did a huge study in Africa about it, and it's extremely effective. So that is a game changer for sure. And if they have been able to release it, I'm not aware of it yet, but that will be great for a lot of people. So basically, the medications, there's the pills, there's Truvada, which is a daily pill that combines 2 medications, and then there's Descovy, which is a daily pill that combines 2 medications. And so that's just 1 pill that you take every day. Apretude is the brand name for a medication called I can never say this word right, but it's on the screen, which is prescribed. It's a prescribed injection that you receive every 2 months from your doctor. So still, it's just 1 shot every 2 months. That's still to not get HIV. It's like 99% effective. So you could be with someone living with HIV. They're on their medication. They're undetectable, and then just for another safety net, you could be taking PrEP and be with them. Or you could just be a single person choosing not to wear condoms, but this is your safety net of not catching HIV, or however you want to do things. But anybody can use it. It's safe and highly recommended. We have people that are considered high-risk individuals that we really recommend it for, which would be people that do sex work, men who sleep with other men, people of transgendered experience, people who inject drugs. Those are people who are at the highest risk for contracting HIV. So those are the people that are who we really encourage to consider taking PrEP if they're HIV negative. Before starting PrEP, you have to have meet with a doctor, have some lab work done, things like that. Most PrEP is covered by insurance. There's organizations that have funding, pending that the government doesn't take it away. They have funding available to cover when insurance doesn't cover all of it, things like that. So it's a very great medication, great prevention tool. The other thing I mentioned was excuse me, using a new syringe every time you inject. So you want to avoid sharing needles and drug injection equipment like cottons, cookers, water, etc. every time you use. You always want to use a new syringe. And when you're done with it, you want to dispose of that in a safe sharps disposal container. You can access syringes here at Vivint Health. There are some other organizations throughout the state that also have syringe services, and you can buy them too, but I think some places there's a lot of stigma, again, that word, that make it hard for people to get them. So thankfully we are around. Hopefully we will still be able to be around because we are part of the prevention money also. Testing, HIV testing is huge. We've got the INSTI test, which is a minute, and the determine test, which is 20 minutes. So it's really important that everyone know their status. It's estimated that only 17%, which is about 6,725 of the 39,513 HIV diagnoses in 2015 were among Americans aged 50 and older. The CDC recommends that all adults and adolescents get tested for HIV at least once in their lifetime, while those at increased risk should get tested at least every year. People who don't know they have HIV can't get the treatment they need if they don't know. So, So get tested and learn your status. It empowers you to make good decisions for your health. As many as 26% of American Indians and Alaska Natives living with HIV infection don't know it. And that's a pretty big number. There's different ways that you can find where your nearest testing center is. There's home test kits that you can get so you don't have to go somewhere, and you can do it in the privacy of your home if you're afraid, because there's that stigma out there. And they also, of course, have the local Indian health services, tribal or urban facilities, and other community resources that I'll talk about later that are available for testing. There are rapid HIV antibody antigen tests. Antigens can be detected 12 to 26 days after infection, and antibodies 20 to 45 days after infection. HIV RNA tests are 10 to 14 days after infection. And there are two different methods for testing: in-person testing or that home test that I mentioned. In-person testing, so we've got the two different tests. We've got the INSTI test, which literally takes 1 minute, which is amazing, and the rapid HIV test, determine test, which takes 20 minutes, which is still great. You don't have to wait for the lab to get back to you in a week or so or whatever. So the way we do it is we start with the INSTI test. If that comes back negative, you're negative. If it comes back positive, then we do, and they're finger pokes. If it comes back positive, then we do the 20-minute determine test. If that comes back positive, then that's a confirmatory that you're positive. If it comes back negative, then you're negative. In most cases, testing involves a simple finger poke, but it depends on the location. So if you were to go to like your clinic or something like that, they're probably going to draw your blood. There's organizations that provide free testing and require little personal information, but this varies depending on the testing location. And some organizations will travel to you and provide in-person testing via mobile services. I am one of those people. So if you wanted, whether it be supplies or testing, if you didn't have a way to get to my office to come get tested, didn't have any other options where you're at to come get tested, I will come to you if you are in the areas that I serve, and I will come to your home, your place of business, wherever you want me to come, and I will test you. I have a space in the back of my big work van that is set up for me to do mobile testing. So I serve Vernon County, Monroe County, Trempealeau County, Jackson County, and La Crosse County. So I do have quite a span that I can do. And then we have, of course, other offices that serve other locations. And DHS also goes out and they also provide services. So there's a good chance that someone can come to you if you can't get somewhere. You just have to make the call. And then this is what the self-tests look like. It's offered to individuals who reside in Vivint Health areas, but I think DHS also has some available possibly. You'd have to go on their website and look, or maybe it's just available to us to give out. I'm not sure. I haven't checked yet. The oral test takes about 20 minutes to get. And you can just go right on our store.vivanthealth.org to order it. For treatment for HIV, there's quite a bit of different options, and the doctor would go over what would be best for the person based on their lab work, what other medications they're on, what their health issues are, their age, all the different factors. HIV treatment is known as antiretroviral therapy, or ART therapy, ART. Begins with choosing HIV regimen. The medical professionals start you on an HIV regimen promptly after your diagnosis to get your viral load and CD4 count under control. And there are more than 30 HIV medications approved by the FDA, and they're grouped into 7 classes that help fight HIV. And these are just some of them. You might have heard of like Biktarvy or Descovy or Sustiva. And the 7 drug classes are listed here. I'm not going to read all those names because they're drug names, and you know they are. And then that's a drug chart. So there are some injectables, mostly pills. And then for community resources, of course, we have the Indian Health Services, which is the National HIV/AIDS Program that coordinates and promotes HIV and AIDS prevention and treatment activities specific to Indians as part of a comprehensive public health approach. In addition to providing medical care to eligible beneficiaries, it also serves as a public health system, and the goal of the program are to prevent further spread of HIV and improve health outcomes for those likely living with HIV and AIDS. These goals are supported through the following. So they're going to look at identifying ways, new ways to prevent HIV infections, and developing like standards of care, reducing new infections through like public health messaging. That is something like I've worked with Renell a lot in. And also the importance of knowing your status. Increasing your routine HIV screening, increasing access to care for those that are living with HIV and AIDS, and like their health outcomes. So making sure people are staying linked to care and like going to appointments and in case management and things like that, so that we know that they're taking their medications and that like any health issues they have are being addressed, and if they have like transportation issues or housing issues or whatever it might be, that those are being dealt with, and that they're not struggling or having any issues as a result of their health. Developing policies and procedures to sustain preventative success, and making sure confidentiality is maintained, because HIPAA is very important. Utilizing the media to expand and access information about testing, stigma prevention, and HIV education to healthcare providers and the people that we serve. So this series that has been going on for the community is great. That's one example of this initiative, making sure that it's accessible for everyone. Nobody has to try to be anywhere. They can get to it wherever they're at, which is great. And and providing technical assistance to the tribes, the organizations, and regardless of the prevention and treatment programs. And they have a brand new page devoted specifically to the LGBTQ and Two-Spirit health issues, which I've listed. And then I've listed their other website down there, which is great. And then we have the National Native American AIDS Prevention Center, which was founded in 1987 to advocate at the national, state, and tribal levels for funding and proactive policies that prevent HIV in Native communities. The mission is to address the impact of HIV/AIDS on American Indians, Alaska Natives, and Native Hawaiians through culturally appropriate advocacy, research, education, and policy development in support of healthy Indigenous people. Of course, we have the Center for Disease Control and Prevention, which houses plenty of resources outlining risk reduction strategies, fact sheets, screening recommendations, and national statistics on STI and HIV rates, some of which are specific to the Indian community. U.S. Department of Veteran Affairs, and they do have information on Native veterans specific to the HIV, AIDS, and STIs. And those resources include links to the Native specific HIV organizations and programs, and also various publications, both for health providers and veterans. And then the National Institute for Health Office of AIDS Research. They have a strategic plan for HIV and HIV-related research, which provides a roadmap for the National Institute of Health to guide HIV and HIV-related research and direct HIV research funding to the highest priority areas to help end HIV, reducing HIV-related health disparities and stigma, and determining the most effective strategies to encourage uptake of HIV testing and prevention are priorities for HIV-related research. So this goes back to the point of I was making earlier about the huge difference in who's getting the treatment and the testing, and who's walking around not knowing their status, things like that. They're doing that research and they're showing us the numbers. So then they're trying to help us figure out how we can better serve the underserved. So then they offer that information to the general consumer, people with HIV and those who take care of them. And that provides us with the information that we need to get back out and provide those things to the community. And then building research partnerships for healthy sovereign tribal nations. This OAR director's blog post describes the collaboration between OAR and the National Institute for Health Tribal Health Research Office. Through this partnership, Tribal Health Research Office helps OAR and the National Institute for Health HIV Research Program work with tribal nations to address HIV in a way that respects sovereignty, is culturally appropriate, and responds to the community needs. We have hiv.gov, and that's just, it aims basically to be visible for all the federal policies, programs, resources, provides information about HIV in American Indian and Alaska Native communities and links related to federal resources, storytelling as a resilience initiative, which uses traditional storytelling to increase awareness and knowledge of HIV and reduces HIV-related stigma, which I really appreciate because storytelling is huge. I'm a big storyteller, and it is a great way to make people listen that otherwise might not, that don't think it's relatable to them. And when they can put some real life experience to it instead of just numbers or, somebody reading at them or whatever, it's very impactful. And then, of course, the Wažookį Department of Health Services does testing services available by appointment with provider, or you can pick up a home test kit. They also do PrEP and PEP. After speaking to a provider, you can see what your options are. And if you are someone that is newly diagnosed, or someone that's ongoing living with HIV, you can speak with your primary care provider and talk about different treatment options. And so those are the numbers for both the Wažookį Healthcare Center and the House of Wellness Clinic. And then Vivant Health, which is where I work, we do PrEP. We don't do PEP, actually. Well, we can do a PEP referral. We have condoms and lube, HIV, STI, and Hep C testing. We have a LifePoint program. So we have the sterile needle exchange and disposal, counseling, referral to various community resources. So we do refer people to medicated assisted treatment, detox, inpatient treatment, outpatient treatment, different other community resources, all kinds of things. Domestic situations, we help people get situated with anything and everything, basically. And then we also give out Narcan and test strip, both xylazine and fentanyl test strips. I'm in La Crosse. We also have locations in Wausau, Eau Claire, Superior, Madison, Green Bay, Appleton, Milwaukee, and Kenosha. So we're all over the place. And like I said, I serve the counties that I serve, and I do deliver supplies and do testing. So I would be happy. And I also do education things. So I come and do HIV, safe sex 101. I do harm reduction 101. I do Narcan trainings. I do a little bit of everything. So I'm more than happy to come present for you if you need me to. And then, of course, today is National Native HIV and AIDS Awareness Day. And just that it's all relative to our experience, and that's what makes a difference. National Native HIV and AIDS Awareness Day highlights efforts to address HIV and raise awareness of its impact in American Indian, Alaska Native communities, first observed in 2007, and it encourages HIV education, testing, prevention, and treatment. The National Native HIV Network organizes this observance and coordinates related activities. You can use the hashtag to follow the conversation on social media and find downloadable graphics and sample social media messages to promote HIV prevention, testing, and treatment in American Indian and Alaska Native communities. Thank you.
Pinagigi, thanks, Jenny. It's always great to see and hear from you, and we appreciate when you come to our communities to provide HIV testing. So such a great presentation. It's amazing how far we've come in HIV treatment. It's just beautiful to see folks living with HIV, growing old, becoming elders. So like Jenny said, Ho-Chunk Public Health does offer home HIV, Hep C, and STI test kits. Right now we have them stocked in Black River at Ho-Chunk Healthcare Center. If you are looking to get one closer to your location, you can email me and I'll find a way to get it to your area. You can also schedule an appointment at Ho-Chunk Healthcare Center or the House of Wellness Clinic for HIV, Hep C, and STI testing. Does anyone have any questions for Jenny right now? Well, hearing and seeing nothing, thank you all for joining us today. As a reminder, this session is being recorded and will be available on the Department of Health website and our Facebook page. We look forward to seeing everybody at our next session on Wednesday, March 26th from 1 to 2 p.m. We will be joined by Ariel Hall from Ho-Chunk Tutor Services. If you would like to add the recurring WebEx link to your calendar, please send me an email and I will forward you the invite. We welcome all feedback related to this series. If you have a topic that you would like to learn more about, or if you would like to present on a topic, please reach out to me. I have put my email in the chat several times. So it's ronell.mckernan@ho-chunk.com. Pinagigi, everybody. Have a great rest of your day.